I'm here with three other fellow Wisconsinites, Melissa Duffy, Bill Toman, and Jim Wesp. I'm a small business owner. I've owned a small business for 30 years. I have 15 employees. 4 of us are in my health plan, and I'm paying $105,000 a year for health insurance. That's a plan with a $5,000 family deductible. So that's why I'm here, and that's why I'm involved in our health insurance cooperative in Wisconsin. Very briefly, we're in the formative stage of putting this together. We've put together a formative board of 13 people, 7 of whom are consumers like Jim and I. Jim is also a small business owner. We put a formative board together, and we're positioning ourselves to apply for a planning grant because we don't have any resources. We have an attorney, thanks be to God, who's volunteering his time until we get a planning grant. We've got a grant writer. We've met with the insurance commissioner's office. We have positioned ourselves with our provider networks. So I think we're in a good position to apply for a planning grant, but we really need to see what the guidelines are, and we really need to see how we can put this together. Wisconsin has a strong history of being involved in cooperative movements. We had 2 people from our state that were on the advisory board that wrote the guidelines. We're very proud of that. They've given us a lot of helpful advice to put this together. So we're happy to be here. I have a copy of our formative board. It's 13 people, 7 of whom are consumers. And if you'd like to see a copy of it, be happy to share it with you. Thank you.
We kind of have a motley crew too. Basically, my background is I was an insurance agent, had an insurance agency that I sold a couple years ago. And I teamed up with a gentleman named Sean Green, who was downsized from another healthcare industry thing, and so we thought we'd put this together. We have, fortunately, a retired attorney ourselves that's helping us, and we have a board of about 7, 8 people that are helping us put this together. Utah has a long history of healthcare reform, so we kind of have an advantage as much as we already have an up and running health exchange. So as soon as we get our products organized, we will have marketing because we'll immediately be able to enter into that market. So that's really good news for Utah. And we're just here, on a shoestring trying to figure out whether there's going to be any money released like everybody else in the room. So, but we've met with the insurance department, and we've got PPO arrangements ready to go, and we've got our actuarial team ready to go too. Everybody's just waiting for money now.
I'm here representing Midwest Members Health. We formed this group shortly after Senator Conrad initially floated his proposal. We've had an ongoing healthcare reform initiative in the state, and some of our key players have been key participants in that initiative. To date, we've raised about, by the end of the month, raised about $100,000. I hope we haven't spent it yet. And we have pro bono contributions from a variety of people in excess of $250,000. We've done some preliminary actuarial studies related to product design. We've built very strong relationships with the largest healthcare provider chain in Iowa, Nebraska. In fact, we will be a multi-state effort extending across both Iowa and at least Nebraska. We have an ongoing relationship that is maturing with Health Partners in Bloomington, Minnesota. We have engaged in the discussion about plan design for the exchange system in Iowa and also Nebraska, helping guide the governor's offices in arranging exchanges that are friendly to co-ops and enable co-ops to thrive and flourish. We're here, or at least I'm here, to listen to the rulemaking, and we're going to execute when those rules are issued. So we're ready to go.
Our story is that and my background is in hospital administration. But for 14 years I've been president of the coalition, which is, and the CEO, a group, multi-stakeholder group of doctors, hospitals, brokers, but the majority are employer purchasers. And so we've been representing business, the private payer of health insurance for a long time, and working on the ground in Tennessee to what we would say is to reform health care in Tennessee. As John said, health insurance is dysfunctional. Well, I'm here to tell you health care delivery is dysfunctional. And so if you add the delivery system's dysfunction to the financing of healthcare as being dysfunctional, we really do work in a square root dysfunctional system. And that causes great concern for people who spent their career in healthcare like myself and for people who buy it. So we've been committed for a long time in reforming it, but more from the side of a self-funded employer. But for 10 years, we have looked for solutions for small employers and individuals in our state, because the larger employers understand that you can't reform health care in our state without bringing in and finding ways to help those sort of at the end of the food chain, which are small businesses. I've been to our state capitol over the last decade trying to change laws related to MIWA. We have a PEO we're very active in. We've experimented with various ways to help small employers. 2 years ago, when I heard, really read in the newspaper and the media, that there was this idea of a co-op that was going to come along instead of the public option concept, I was very excited that this might be an opportunity, working with the federal government, to import into Tennessee a very viable way to help small employers. So our coalition, this group of people I've described, got behind this idea of a co-op. We've had, like the gentleman who just spoke from Iowa, well over probably $400,000 worth of in-kind services. We've raised $75,000 seed money to help pay for an outside consultant, Melissa Duffy, who's very good at this. She's in the audience.
It's our expectation that when we see the rules and regulations that there's going to be a very stiff process that one is going to have to go through in order to utilize the federal funding, basically an RFP kind of process. And so if we put anything in place right now, we'd probably have to tear up the track. And that isn't going to do us any good or any potential vendors any good. Having said that, we're having extensive conversations with high-level technology providers such as ACS, CSC, Aon, and others, trying to understand where their cost curve is on services and where we have to get in terms of enrollment levels. And it looks like, depending on how you parse it, we need about 100,000 to get to sort of the first plateau level of the S-curve on costs, and about 250,000 insurance is going to get us to a level basically that would be competitive with anybody else, in the country. For legal services and others, we've again had a pro bono relationship with the expectation that going forward in the future that we'd be actually able to retain folks.